disclosures here. I have no disclosures on menopause, meaning there is no benefit or there is no financial thing. This is more to help the body of Christ. And so menopause as an introduction. The word menopause are two words that have come together. Is men and pauses. The men means monthly. And then the pauses means cessation. And as I'm doing this, I'm still trying to see if I can get this to share, because if it doesn't share, I think the benefits will go down. And so this is not how I wanted this to play out.
Of Akwasi nyahwe ankoya next obesa baby into the can say actually no asa baby.
Okay. And so the word menopause really has got to do with so men is monthly, and then pauses is cessation. Cessation it just say bibi ejai, and monthly it just say bosumi be happen almost every month. And so we are talking about monthly cycle ejai, the monthly cycle that is supposed to come every month has come to an end. That means it has paused, and that is the meaning of the pauses. So a menopause, monthly cessation. Typically, yenim say for the female population, you are getting a cycle once every month. For some people, it's 28 days. For some people, it's exactly 4 weeks. Obia on a cycle, there are variations here and there. But whenever that cycle stops, then we are talking about menopause. Normally, people start experiencing the symptoms of menopause, and now say their cycle starts changing around 45 to 55 years, and so a range. But in the US, most of the time, the median age, or most people in menopause, anywhere between 51 to 52 years. And so that is the range that is expected, say most people will have menopause. Menopause itself can be natural, and then it can also be induced. Say you can nature say a idea happen on its own. It just happened on its own, natural. And the one that is induced means you did something, or something was done to you and a man by. In terms of something done, bibi to say surgery, ebet miyama obi ago menopause before the due time. And then bibi to say chemotherapy, say if for any reason nipa kro enya cancer, na yet treating a cancer no ebet miyama menopause no aba earlier than when it is planned to come. Bebantem than time cra was say eba. Your normal cycle starting every your brain. Into your brain your gland be your friend pituitary gland. Sa gland nia ni say a release hormone every your brain Into sa hormone na a release free your brain hormone free your brain na about to the ovaries. And about ovaries now is stimulating ovaries, not ovaries na release what we call estrogen and now say progesterone. Those hormones a free ovaries nasa hormones by your uterus so. That is the reason why your uterus get thickened the normal cycle that we get every month. So the cycle starts from the brain, back to the ovaries, and then from the ovaries to the uterus. That is the normal sequence of events. And so for every month, as we continue the cycle, we get our normal menses, which means to say, if any of these cycles is affected, it can push us to menopause. Meaning that if for any reason the ovaries is affected, it can give us menopause. If for any reason the brain is also affected, it can give us menopause. And if for any reason the uterus is affected, it can give us, in inverted commas, menopause. Here later. Enti normal menopause nature say ovaries no, and what we call follicles. So follicles no they release hormones in mind. As we age, no, we lose a lot of these ovary follicles. And to say you lose follicles ne dia net say yenya hormones na if free follicles ne mo no. And so those hormones will go down. So natural aging process no will result in the loss of the ovarian follicles and its associated hormones. The hormones that come from the ovaries will go down. And when those hormones keep on going down, it then pushes into what we call the natural menopause. Artificial, and also what we call the induced menopause, no, is when we do something for whatever reason, surgery or chemotherapy, and no you lose the follicles, no. And because we lose the follicles, we certainly don't have the hormones. And because we don't have the hormones, we go into menopause. So for all both scenarios now described, no, they all have got to do with the ovaries and the hormones that come from the ovaries. The question is why and how are you losing the hormones? One of them can be a natural process. The other one can be an artificial or an induced process for whatever reason. So that is the natural menopause. And then the other one we talk about is artificial, and I'll say it is induced. Say you can normal menstrual cycle now. First, no cycle no started from teenage into infant or first menstrual cycle. No, Brony friend is a menarche. That is the very first menstrual cycle. For every female population and for every female. When you say menstrual cycle now, from that time when your menstrual cycle now him say ubenya menopause no, your friend no pre-menopause. Pre means say unya indru menopause or a before menopause. So we call it pre-menopause. And then unya menopause no, and then after menopause no, we call it post-menopause. And so there are two things that I've mentioned. Niyama mienu na maka ho asem. Baako eye pre-menopause and baako ye post-menopause. Pre-menopause no, from your first menstrual cycle till say obenya menopause. All that period is called pre-menopause. And then after menopause, 12 months after that, everything is called post-menopause. There is a period a year around the time say unyanya menopause no, but menopause no ebeba. That time no your friend no perimenopause. The entire your friend no say menopause no ebeba is because around that time no you still get your cycle, but a very irregular. Meaning that a cycle, if it was 28 days, it be about 20 days, it be about 24 days. If the cycle was lasting for, let's say, 5 days, now it will last for 3 days, or it lasts for 2 days, or last for 4 days. Into a very irregular, and that is approaching the menopause now. And so we call it perimenopause, a little different from pre-menopause now. So maka premenopause and maka perimenopause and maka post-menopause. There are other two I will say you asem. Baako ye friend no early menopause. Early, just like the word early means when your menopause no before the time that you are supposed to go get the menopause. So it's early. It is typically anywhere before 40 to 45 years. Into unya menopause anywhere before 40 to 45 years, it is considered early menopause. And then the last one I will say is a friend of premature ovarian insufficiency, and now say you might hear the term primary ovarian failure. Premature ovarian insufficiency no, it happened before 40 years. And in that case, no, unya the normal cycle, the way. So when you cycle now for a certain period of time, but now it has stopped before it was supposed to stop. And so you are not getting normal cycle. You are not releasing eggs as usual. And that is called premature ovarian insufficiency. And your early menopause and your premature ovarian insufficiency and your pre-menopause and your post-menopause. All these are terms that you use to until Dr. Becker say when you're early menopause and now say premature ovarian insufficiency. That is the meaning of the terms. But any menopause happen around 50, 51, 52, 53 going on, then that one is expected. And so it is not a problem. Going from step to step, menopause no said and it can be from the level of the brain, it can be from the level of the ovaries. And if ubi wakoye a certain kind of surgery on the brain or your friend pituitary gland, wakoye surgery or because wakoye surgery no in hormones na free pituitary no emba embassy ovaries ne so amba embassy ovaries ne so assign pakrono or be presented with say obia or menopause. And that is because the hormones name. Likewise, the wakoye surgery on the ovaries no so be present the same way. The next thing I was say yekuno anase osuane say okay, into menopause ye kan ho asem. How does it present? How does it show up? It shows up in a lot of ways, but you better try see, you better discuss all of them. Na afi hu kwanya you better fix the problem no. It can show up with a lot of physical changes. Changes are ibihuni ye nipeduemu. Such changes maybe ebetimi happen ewo skin no so anase or hair anase or breast. On the skin no, how does it show up? On the hair, how does it show up? On the breast, how does it show up? Okay, into skin no, the best show up ne say ubo se wo skin no aye more dry than usual. The hair is also more dry than usual. And then for the face, no, you are seeing more wrinkles. There is increase in wrinkles on the face. That is how menopause can present. Until you realize that first, now, hey, that's so come, bibi out also come, but say no, even if food in kuni bibi ayem crash, still, and I say changing basa. And then once we name now wrinkles now starting air, but more than what you've seen before. And then no for so bon say fat one for na a free month na I am more flabby, what is described as flabby. Yabeka ho asem kakra. And so those are some of the physical changes menopause no edeba. Those are the physical changes menopause no edeba. More on the physical side, the breast, the skin, and the hair. There are times where you gain a little more weight than usual, but that weight no happens to stay around the waist, it happens to stay around the hips, and sometimes it stays around the buttocks. Those are places that will gain a little more weight than usual. A DMBiome and a menopause no it show up. There were what we call hormonal changes menopause na edeba. So what they can't see, they can't catch us hormones be to say estrogen and progesterone, a free ovaries number. If some hormones we are not coming, if you are not getting these hormones, then you are not getting the benefit of these hormones. How do they show up? Hormone no patient neighbor, but now a cultural say he's getting what we call a lot of hot flashes. Happen for maybe about 15 minutes and sana call. But obia or them hono doesn't feel that way. They feel that. There are times it can happen once in a day, it can happen twice in a day, or it can happen more times in a day. And there are times that problem may happen even during the night. Nipakro ada And then he gets a lot of these hot flashes during the night, which is described more like night sweats. It happens sometimes, and then they get a lot of anxiety. So these are presentations that we see in menopause. These are presentations that we see in menopause. And these presentations are happening because the patient has lost a lot of hormones. Progesterone and estrogen, the most important hormone that mediates a lot of this is estrogen. And when you say hormone now, you end up having a lot of these hot flashes, which you never had previously. So that is how it shows up. And then how does it show up again? The same thing can show up in your genitourinary system. Now, when I say genitourinary system, meaning from your genitals, you will realize that inside the vagina is very dry than usual. You realize that you are having more urinary frequency. You realize that you are more prone now to what we call urinary tract infection, which was not the case before. And the reason is that these hormones, these estrogen hormones that we are talking about, these estrogen hormones help with the layer of the vagina, helps to keep it moist, it helps to keep it fresh. And if you have lost that estrogen, now the vagina becomes more dry than usual. And it becomes a lot of discomfort when these people are having sex, because you are in the menopausal area. You ask, why is it that all of a sudden sex was never a problem, but now you have a lot of discomfort with sex? And that is because the vagina is drier than what it's supposed to be. And there are ways that we help to treat all these conditions. In order to help make sure that we are following well, I will talk about some of the ways that we treat this as we go along. And so I mentioned about the physical changes that you get, the physical changes, the hair, the dry hair, the loss of the fat in the breast, the skin. Sometimes there are things like vitamin E helps people. And then there are things like you do a lot of moisturizers for the hair. In turn, people use vitamin E, people use what we call the flaxseed oil. In terms of the weight gain and those things, it is more of increase in physical activity. You have to be exercising more, doing a little more physical activity. Even if you cannot exercise, you can be walking, taking walks here and there. It helps. But you can't, there are no medication basically to decrease the fat. These are things that are coming that you work on them to decrease that. And then we also talked about the genitourinary system. The genitourinary system, how do we treat that? When the vagina is very dry than usual and a lot of discomfort, there are medications. There are medications that we give that you can do them topically, and it helps to keep the vagina moist. It decreases the pain and the discomfort that come with the sex. And then I also mentioned about what we call the vasomotor systems, meaning, there are a lot of hot flashes all over the place, and you feel like, you are sweating. There are medications that you use for those conditions. Some of those medications are pills that you will take, which comes in the form of estrogen pills. Some of them are patches that you can put on. Some of them are topical that you can apply. All these, most of them are estrogen based. And the reason why they are estrogen based is that that is the hormone that you have lost. And so that is the hormone that if we replace, then it will help with your symptoms. So there are those that are transdermal for the skin. There are those that are topical, and there are those that are pills that you take. Most times we advise people to wear light clothing and not very thick clothing. And again, because you are having hot flashes, you are on a thick clothing, certainly that is not going to help. And then we tell people to avoid things like alcohol, avoid things like caffeine. Those things don't help with these symptoms. Then there are other changes that also happen during the time. So we have talked about genitourinary, we have talked about physical changes that happen, and then we have we are now talking about emotional changes or psychological changes. There are a lot of mood swings around that time. And so when it happens, and all of a sudden it looks like the next moment what is happening? All of a sudden, that is why we say men, pause. So the men should pause and understand the woman that something else is going on which is different from the normal. They have lost a lot of the hormones, and because of that, it can lead to a lot of mood swings. It can lead to a lot of irritability. It can lead to a lot of depression, and it can lead to a lot of insomnia. Until once a time or down, no one or take up and down, or sorry, now still went to me under year because hot flashes never know until me in that time. No, a person also fan this so the next moment of person doom fan no, the next moment of person so fit. So it is not because nipa kroni why it is because of the way the person is feeling. Naturally, the person has a decreased interest in sex. Why? Because there's a lot of discomfort during that time. And so clearly, there's a decreased interest in sex. There's a decrease in social interaction most times, or them and what do no so in social interaction no eswati the pakra first time be sorry no new din common no say now there's significant change in their social interaction. And there is what we call cognitive impairment. So that person now begins to forget things easily than before, and then has a lot of what we call word finding difficulty. That is all coming because of the same menopause that we are talking about. So the mood swings are happening because there are a lot of hot flashes, there are a lot of nights where the person is not sleeping well, there's decrease in social interaction, cognitive impairment is setting in. How do we help to treat all these things? If you are we come to the hospital or you are seeing your doctor in the clinic, they are helping you with those estrogen tablets. If it is helping with the hot flashes and helping with the night sweats, naturally that would also help to decrease the mood swings. There are times that we don't use those medications. We use other what we call non-pharmacological medications that we can use. So there are times that we don't use the estrogen pills. There are other medications that we can use because there are some group of patients who cannot take the estrogen pills because of a reason. They have a history of blood clots, they have this and that, so they might not be able to take it. For those people, we have other medications that we give to them. If there is a lot of social interaction, those are the times that we encourage them. Get into a certain network. Get into a network with the same peers that you'll be able to talk, you'll be able to interact with them. Find a way to get conversation going. If you stay in the house yourself, you get more depressed. Find time to be reading and be listing things to do because naturally you are forgetting things. Naturally you forget. And so the best thing to do is always make sure you have things to do that you are listing them down. And when you are doing those things, then those things will certainly help you to be able to catch up on the things that you have to catch up. In terms of the increase in urinary tract infection, for those patients, when you give them those topical estrogen that I talked about, it's helping with the vaginal wall. Most times, it also helps to decrease the urinary tract infections that they get. And I have talked about how we treat the sex and the painful part of it. So these are symptoms that women show in menopause. But what we need to do is to understand why they are showing those symptoms. And if we understand, then it helps us to be able to live with them with all wisdom and with all peace. Amen. So there are other ways too that we help. And there are some exercises that most times your primary doctor might be able to talk to you. There are some exercises, we call them the Kegel exercises, that help to strengthen the pelvic wall. These are exercises that can be taught in the clinic when you talk to your primary care specialist. How does it also affect your gastrointestinal system? So when you get to menopause, one of the things that you see commonly happen is constipation. So we always advise patients that make sure you are getting a lot of fiber in your diet, make sure so you are using stool softeners if you have to use them, because they are very necessary, they are very helpful. The other thing that it does is also affects your bones. And so under normal circumstance, during the pre-menopausal area that we talked about, which is from your menarche, from the time that you have your first menses to the menopause, it is the time that you are getting a lot of estrogen. Estrogen is a hormone that helps to strengthen your bones. And so when you get to the menopause phase and you lose estrogen, naturally the bones become weak. And so people get what we call osteopenia, and people get what we call osteoporosis. Osteoporosis is a step beyond osteopenia. So there's normal bone, osteopenia, and osteoporosis. How do you treat these things? If you are not on medication, to Dr. Ma will do necessarily for osteoporosis things like calcium, things like vitamin D, things like weight-bearing exercises. They help a lot in strengthening the bone. If it gets to the severe form where you have true osteoporosis, then those times you will have to see your doctor, because there are medications that we use for the real osteoporosis itself. But if it is not osteoporosis and it is either osteopenia or it is normal bone, then at that time, calcium, vitamin D, weight-bearing exercises will be enough. So these are some of the things that happen during menopause. These are the reasons behind the things that are happening during menopause, and these are the ways that we treat them. The aim of this talk is to make sure that we talk about everything that we need to talk about menopause, and then people ask questions that they have about menopause, and also for the female population, for you to understand why what is happening to you, and then for the male population, for them to understand this is what is going on, and so you need to have patience for the man or the woman that you are living with. So I will hold off here. I will pause here, and if there are any questions, we will address them, and then we go from there. Thank you.
Thank you, Doctor. And our power addition de my show you what time kakra, so be with any questions and ask contributions to me at the abasi.
Yo, Doctor, Yadasepa. Na a presentation you stress a lot more on estrogen. But from a readings there are certain medical experts and doctors who emphasize more on progesterone. I don't know if you know about a Dr. Ingrid Trobish or a White Row extensively on this topic. And there used to be one Dr. Cosello Manhattan or fertility clinic, also who make a lot of presentations, but she emphasized more on progesterone. There used to be a lab war, Long Island, who promote progesterone. In fact, progesterone cream. They had a booklet now where emphasize more on progesterone to handle a lot of these situations. Again, I don't know if you remember, there was a trial in Texas about a woman oku number bear force of 5 or the one share birthday. First, she was convicted for that, but later on appealing, the lawyers brought in some experts, gynecologists. They use this what you call the balance between progesterone or estrogen to explain what she had to go through and why she couldn't be held guilty and all those. Eventually, she was freed. And so these discussions between the balance of estrogen and progesterone has actually been going on. But I realized that maybe it's a standard American medical area. They emphasize more on estrogen. Patti LaBelle, some time ago, she was advertising for hormone replacement therapy based on estrogen. It went on. Then later on, reports it became dispute the mayor. And so she came out to apologize for the harm she had caused a lot of women because she had advertised this estrogen issue. And so I don't know how you feel about this a balance between estrogen and progesterone. But my point is that a lot of experts emphasize more on progesterone as being the life hormone for women who save one from this situation. Actually, it turns out that it's the lack or reduced estrogen, progesterone hormones on and on a lot of discomforts with women during this menopause, and they discuss how a progesterone, a lack of progesterone, will lead to all these bone problem and all those things, and how you can relieve yourself by the use of a progesterone cream. In fact, some of them even make reference to a African situation like the Yoruba and all those things. The diet of a yam, or what they normally refer to as wild yam, is because of its content of progesterone, will relieve a lot of, especially Africans and people who are subsist on that diet, and also in this their menopausal age because of the high content of the progesterone over them. It's banned. I don't know if you know about it. What are your comments on it, Medasi?
So they are part of the discussion that might be beyond this presentation. Most of the things that I talk about, most of them are evidence-based with, let's say, American Academy of Clinical Endocrinologists, Endocrine Society. There are those that are outside. Most of Nyamanawakan Ebiwahwa, they have not been what we call randomized control trials. There's a way I studies to be able to establish something, and some establishing, and then it becomes more of a standard of care. There are some studies that are done with not randomized, so they are a little beyond maybe this presentation. But what I want to mention is, so most of the things are evidence-based, based on these societies. These are leading societies in the US. These are accepted societies. American Academy of Endocrinologists, American College of Obstetrics and Gynecologists. So these are their presentation, and these are their standard. Almost standard is to go with estrogen. And then we only come with progesterone. So there are some cases that the patients still have what we call an intact uterus. And so for the people that have intact uterus, we do estrogen and progesterone. But there are a lot of other things that come outside. There are more than what we can discuss here. There are those that come with hormone replacement therapy that has got to do with cardiac effects. There are hormone replacement therapy that has got to do with breast cancer. There are hormone replacement therapy that has got to do with stroke. There are lots that if you can see, I don't think we'll finish this presentation. But I want you to know that most of the things that I have talked about now are the standard of care. That is what all the big societies in America practice with. And the other few things that are outliers, they are things that we can discuss maybe out of this presentation.
Your dog, I mean, medical personnel, but I've been interested in this for so many years, and I've been following a lot of it. I have no doubt today you are presenting the standard American medical on it. But the point I'm trying to make there, all those was stress on progesterone has been the life they actually are not really out of the stream, but we tend to understand that because of maybe pharmaceutical companies in one strong influences on American medical aid, and so they try to project these things in favor of those aid. The next other issue in there, even where the American system had accepted some level of progesterone influencing, they tend to treat these people with progestin, which is rather than real progesterone, which is not it doesn't have the chemical combination of progesterone, but they presented, and that progesterone, it said it doesn't give the necessary what you call results equivalent to that sort of progesterone, whereas a simple progesterone cream, which is topical, what you wear 1 hour twice a day, can actually give you complete a year. I have no doubt about your expertise and your knowledge in this, but the point I'm trying to put across in there, in many cases, some other what might call truth or other facts might have been neglected by the American medical aid simply because of the influence of the pharmaceutical companies on the medical system. Now, I have no doubt about what you are saying, but I'm trying to put across their alternative area, and not simply because of the American about it, but I know individuals who have used those which have relieved them of a lot of these, especially menopausal symptoms. Now, if you read about this lady, Ingrid Trobish, new presentations now, new writings now, I think that it gives you a simpler understanding about this balance between menopause now, these things, a detailed understanding about these things, and I know that it has worked for a lot of women who have come to realize it. My interest in this, because I had a wife, I have two daughters. I know about these things, and so I've been going over this thing well over 40 years. I've been following this issue. We have from Liberia, a Catholic nuns, a radio program. They used to emphasize on this natural issue, factors or help in Besiafu. Then I have in Great Trobish. I'm not saying that anybody should believe me, but my point is that there has been some of these issues. I quite remember that some months ago, a young lady came in to make a presentation about fertility, and I tried to draw her attention to the fact that there were other alternatives. A lady got on board. I don't know whether she has relationship with whatever I put across, and I think that she took it wrongly or personally, and she was very dismissive of it, to the extent that he said, "Oh, this is Google information." And no, it's not Google information. It's a practical. That's why I made reference to Dr. Costello's fertility center in Manhattan. These are people who believe, and all the lot of research on that.
Thank you very much. Not to interrupt you, but I also want other people to have the opportunity, because otherwise it becomes only 2 people discussion and we have about 20 people here. So let me make sure that other people also get the opportunity to be able to ask their questions so that they can also get some feedback. I think I can see a hand raised here. Dr. Becky Akwasi is up here. Okay.
Me that say Dr. Richard. Asemwa, Mr. Ghani contribution is very important. What it is that ye omeya ya befremu, you know. Said you di kan kase pharmaceutical womo bibi omo yentino. Unim say yari bi ti say cancer. Adentina so many years. America enti minye dry bit media prevent. Because omo ya ediene besi omo sika so bete. Smoking. Enti omeyi nim senye. Awiasi nyina nim senye. They know. Basika omo making tino. Omo mpese ombeka no kre. Asemwa Dr. Eka no say near omeyi ana awiasi aje atumu. I'm telling you say asemwa Mr. Ghani Keno. There are enro ahudo bi ana say natural herbs near no. Dear ye omo aje omo edi se omo na ye edro omo ye nro no omo mehu. But for it to be accepted, also a go through studies nipa nyina peer review obia kana dwene na fe ye de abeto ho no. Eno nti Mr. Ghani wasem na o kan 100% na doctor anso de na o kan so 100% say eno ena nipa nyina agi atumu adesuafo hwan pharmacy a doctor for researchers. That is the difference. Wo de na o kan obi antimi nka se enye nokre. But the one kratem no ena doctor Eka no. Obu wo no so nka obenya kwanya anya wo de no a ebebo apa. Until then no ye didimu sa na chese de omo no Eka no ano. Eno untumi nyina hona wonka asemu a eni mumamu. Eno nti ena tesa. Wo de no beye nokre. Nanso de one kratem a obi agi atumu no. And no, and Dr. Eka Mwasem. Madam Mwase.
Thank you.
That's some pacho obi the question be to chat in me. Just obi to me.
Pacho, as we go ahead with that, let me go to the chat here and let's go here and see the question representation. Can menopause get? I'm assuming that HPV virus is what the person wants to talk about, but can menopause get HPV? Meaning, if I understand the question is saying, say, obia or menopause, now, can he get an infection from HPV? Yes, the fact that you have menopause doesn't mean that you can't get any STDs. No. And you can get any sexually transmitted disease and you can get any HPV. Because remember that it has, right, okay. So the person is asking about the virus. So remember that these viruses live in cells, right? When you have a vaginal atrophy, yes, the cells in the vagina are atrophied, they will be able to. But remember that HPV doesn't necessarily live only in the vaginal cell. They can still live in the cells on the head of, on the cervical area. And so you can still get an infection from HPV.
Can the person get the vaccine?
Oh, you are asking the HPV vaccine?
Yes.
Oh, okay. So if you are asking about the vaccine itself, can menopause get HPV vaccine? HPV vaccine have got an age range that you get it. And so if you don't get it in that age range, I'm not 100% sure whether for a 67-year-old patient, at that time, you will be a candidate for HPV vaccine. That is, for a 60-year-old or for a 52-year-old, can you get it? Yes. Will you qualify to get it? I'm not sure you necessarily qualify to get it that time. But you can.
That's a question, Paco. Open customer said no one na effect to the cruise or that on the one that none the that is a sign of business and say, oh, your man. I'm probably watching an area. It means that's a question. I remember positive. Now, cast a member. When you said almost me buoni. Now, you said to us, Obanica, if I want to say. Now, resource blended women no, but no, I could a doctor home. And now I was surgical as a proceeded to high, but man, no, I'm also every do soon the symptoms are the mass channel. I hear Nietzsche. Same question.
Me pacho, if me tell question nasia, you are asking Qgsda ebeboa obana na se bema no.
Bermano. So Bermano, I know I got to be young, Bermaning up symptoms from about pregnancy, menopause symptoms. It can refer to Bermano. So the person of symptoms near one cheer. Until no resources being in it be my woman and as them a prono and as a sticker to the do a while that man or non so man the symptoms now. About one after few or no as a plan again.
Okay, making sure say I understand the question well. So one, for urbanic symptoms, no, there are multiple things that we talked about. If I can go back to some of my slides here, I mentioned, say, some of the symptoms talking about, I'm saying you started by mentioning, say, Bemano, other places because he's not getting what he's supposed to get at home or he's not getting what he wants to get at home. And Urbano has lost interest in sex, most likely during that time. And that is because one, a lot of mood swings. Number two, he's getting a lot of hot flashes, getting a lot of night sweats. So all these things are adding up. They are not interested in sex. How do you help the woman? That is when we talked about the hormones that we mentioned. Bemano. How do you help the man? Right. So the Bemano, the job of the man now is to understand what is going on with the woman. Is there any medication that you necessarily give to the man to treat the condition that the woman is going through? No. And is there any medication that you give to the man to necessarily say, let me give you this one to decrease your libido or decrease your desire? Not necessarily, but you can let the man understand that what is happening to your wife is normal and is natural. It is not because your wife is staying away from giving you sex or your wife doesn't want to give you sex. This is what is happening. She's having a lot of discomfort when there is sex. She's having a lot of night sweats. So these are the ways that we can treat your wife in order for her symptoms to improve. But there is not a medication that you give to the man that will necessarily suppress his desire or anything of that sort, if I understand you well. Absolutely. There are a lot of resources. I mean, for the men, absolutely. And there is a whole big discussion about andropause. We don't want to talk about it now because that is a whole big discussion on itself. But yes, there are resources. These are people that the men have to go with the woman to the clinic. You go to the primary care. There are a lot of resources that we can give to help the man. Absolutely. I think I'll be able to send some of them to anti-patients. Yep, we can do that.
Lieutenant Mr. Chum, Pacho.
Yo, Doctor, the can ye that's papa new presentation na. Say me adiana nka me baby no what the can ka ho asem. Eye na me bisa say ye me man so ye free bibi andropause. Ye stage no no so symptoms no kakra bi but time unti na me di kan me da say man pause. Some mood changes na eba emamu no ye mu bi a experience bi a make a chere me wala is say ekoba sa say unya abutrema ema no pa Manuel Simidasi, Doctor.
That's it.
Yeah. If I should be with any other questions, yeah. And any contribution. All right. Any impact?
I think the only thing I will mention, I didn't say initially we struggled to show the slides. For some reason it didn't show, but I'm hoping, I think Obi put in just a question. For some reason, I think it's showing up now. So that is good.
Any impact show. So be any other questions and contribution the program no ABC I say and Dr. Edawase Power edition and udi name HHA even with the technical difficulties ni na what me amaye edition kese yeda omoma questions and contributions ni na so ase then I assess na by BTA program ne be ebisa questions and contributions Emma and addition also I successful then I say and mobile be recorded program no MI na recording no be available on Queen's Women Ministry WhatsApp page so na only honor so betimi akọ YouTube channel the live stream of any program no ewo omo channel so it's a bit me I refer am for to my YouTube channel na say nya link no WhatsApp page no so with me asend am obusia na so wadan for be na omo nyina so etimi anya adesua ene nyina yetebe no omo nyina anya mochefa eda nyina ya se e pacho ansana ebefu
Pray anytime, pray when you're sad, pray when you're glad, pray when you're weak, pray when you're strong, just pray and pray, 'cause anytime is prayer time. Pray, pray, pray anytime, pray when you're sad. Pray when you're glad, pray when you're weak, pray when you're strong, just pray and pray, 'cause anytime is prayer time. Ooh. The offices in heaven, they're opened up for you every second.